Hi, I'm Tammy Wolf, a certified dental assistant since 1969. What you are about to see is a dental staff training video on how you can implement a bleaching program into your office. If your dentist is like mine, he or she has purchased many videos for you to watch, which are meant to educate and motivate you. While all of them are educational, few tend to be motivational, and for that matter, even interesting. Therefore, Lifelike is giving you a new approach which will not only be educational and motivational, but hopefully entertaining. There are those of you who will say we have stereotyped the different staff positions in the dental office, and you'd be right. But bear in mind, we did it only for fun, and it is only meant to enhance the educational part of the program. In fact, if you get the urge to act like any of the staff members in this video, please contact your therapist immediately. Well, now it's time to get on with the show. But before we begin, let me explain one thing. One of the first things that everyone in your office should do is bleach their teeth, because one's own personal experience is their best success story.
So, like Becky tells Ronnie that it's totally rad. Well, you know what I mean, like completely radical. Oh God, somebody was trying to hassle me again. What's their problem? It's only their teeth. Smile Center, may I help you? So you have a swollen jaw? Listen, could you try to speak a little more clearly?
matey.
You're really hard to understand. Yeah. So, does it hurt? So, like, it hurts a lot. Yeah. Well, it's like, what do you want me to do about it? Yeah.
Excuse me.
Listen, I'm gonna have to call you back. So, how can I help you?
Yes, I have an appointment with Dr. Payne.
Wow. Oh, good for you.
Yeah, right. Well, hey, you know, what's with all these people here? Every time they smile, there's this bright glow and this weird sound.
You mean like this?
Yeah, that's it.
Well, you could have it too, if you wanted.
Really? How?
It's called bleaching, and it's easy. And in a couple of weeks, you could have a bright, beautiful smile.
Does that work for everybody?
Oh, for most people, it works wonderfully and fast. In fact, some people say that it has changed their lives. Oh, could you hold on a minute? I have to get this person on the phone. Thank you for holding. How may I help you? Hello? Hello? Geez, some people just have no patience. No patience, get it? Okay, well, anyway, like, oh yeah, if you just fill out this new patient form right here, I see that you're here for an exam, an x-ray checkup, and then we'll check with Dr. Payne and see if you're a candidate for bleaching.
Yeah, I just got this flyer in the mail, and I understand that I can get a brochure about getting my teeth whitened. Is it true?
As if I don't have enough to do already. Now I have to hand these things out.
Good candidates for bleaching include 1. Patients with yellow teeth, shade B3, B4. 2. Teeth with uniform discoloration. 3. Teeth discolored by age. 4. Ex-smokers who make excellent candidates. 5. Tetracycline stained teeth, which are difficult to bleach, but patients are usually thrilled with any improvement you can give them if they are forewarned. One of the best things to remember about promoting anything is that it's important that everyone connected with the product be interested and enthusiastic, from the person at the front desk to the dental assistants and the hygienist, even the dentist. Everyone needs to be willing to promote bleaching. One of the reasons I enjoy getting my patients to bleach is that they always return with big, beautiful smiles and warm, enthusiastic gratitude for my having helped them to achieve more self-esteem and happiness Believe me, it's a great feeling. So it's important that everyone participate, even the hygienist.
Look, sorry, I didn't get a chance to floss this morning. I know I probably should have. It's just, things got a little crazy, and just please don't yell at me. How? Well, at least you didn't yell at me.
Well, Alex, have you ever considered getting your teeth whitened?
Whitened?
Yes. There's a technique for removing stains on the teeth that's called bleaching.
It actually whitens your teeth?
Yes. We do it right here at the office.
Is it a hassle to do?
No, in fact, it's quite simple. All we do is make a mold of your teeth from which we make a bleaching tray. Like this. You put some bleaching solution into the tray, and then you put it on your teeth. It's very simple.
Yeah, but how long does it take?
Oh, most people see results in just a couple of days. It takes 7 to 12 days for complete bleaching.
Is it expensive?
Of course not. You're getting it from a dentist.
Have you bleached your teeth?
Of course I have. Completely changed my life. I used to be very serious about life. And now you can see, I'm a happy-go-lucky kind of woman.
Yeah, I can see that. My, that's amazing. Smile again. What's that sound?
When you use lifelike bleach, you hear that sound when you smile. It's beautiful, isn't it?
It's nice.
Mm-hmm.
But a little muffled.
Oh, that's just because I'm wearing a mask.
So, you think this would help me, with my chances, with women?
Well, let's see where you are now and what improvements you can expect. You see this? It's called a shade guide. And what we do is put it up against your teeth, where we find the color that best matches your teeth. Let's see. Ah, here it is. See? Now we look over here to the beautiful bright white that your teeth will probably be once you've bleached.
Well, that's amazing.
Mm-hmm.
So, you really think this will help my confidence? With the opposite sex?
Well, let's put it up against your teeth and see what happens. All right, relax. Oh, my. Yes. I can really see a difference. Oh, now, let's see. Is it warm in here, or is it just me? Oh, I can't believe how warm I'm getting. Oh, yes. I think it helps. So what do you think? Do you want whiter teeth?
Yes! By the way, will you go out with me?
You must be reading my mind.
Actually, I was just reading your button.
Oh, I just love a man who knows how to push the right button.
If patients aren't made aware of what's available to them, they won't ask. Therefore, we have developed a variety of marketing tools that your office can use, including a button that the whole staff can wear to generate questions. In fact, Lifelike can help you develop a marketing strategy that will help you reach out to a large patient base. Besides the button, some of the things that you can do are to write a patient newsletter where you include articles promoting the benefits of bleaching. You can also offer discount coupons, gift certificates, and a free syringe of touch-up bleach for each referral. Through a drawing or some other contest, you can choose an entrant to bleach at no charge. Then you can write an article in the newsletter about the winner. You will also have a list of patients who entered the contest who are interested in the bleaching process, to whom you can offer a substantial discount. A very important item to promote bleaching is a photo album of before and after photographs of patients who have been bleached. This album should include all the staff members, the dentist, and the patients. Actual photos are much more effective than any pictures from brochures or magazines. Patients will even send letters of thanks that will tell their success story that you can include in your album. It's definitely one of the best-selling tools that you can have.
I see that you're not happy with your dingy, stained, ucky teeth. Well, you've come to the right place. But before we can start you on your way to a beautiful smile, we're going to have to take some x-rays to make sure that you don't have any nasty cavities or leaky plumbing in your restorations. Before I whitened my teeth, I was pouty and frowny. But now that I have a beautiful, shiny smile, I'm happy and full of life. Now we're going to take your picture. You just stay right there.
Is this gonna hurt?
Of course not, silly. You don't smoke, do you? Eat red meat? Drink genetically altered milk? Wet your bed? Suck your thumb? Bite your fingernails? Then you're gonna be just fine. Here we go. Don't move. Now, while these pictures are developing, here's a photo album of people right here in our office who have gone from dull brown frowns to bright white pearly whites. There's Chrissy, our other dental assistant. Isn't she beautiful compared to the old days? And there's Sarah, our receptionist. And there's our hygienist. She used to never smile, but now, well, and there's him.
Him?
The doctor, silly! Now, if you look real close at that picture, you can see how the bleaching process is done.
What?
Just look, knucklehead!
First, we make a mold of the patient's teeth from which we pour a model. Once the model is dry, we take blockout material and draw it on the face of the tooth, keeping it approximately 1 centimeter short of the line angles. It's also important to keep it about 1 millimeter short of the soft tissue to assure a tight cuff in which to trap the material. After doing 1 to 3 teeth, spray on the activator to harden the material. It takes about 2 squirts from 10 inches. Be careful not to do too many teeth between sprays of the activator, as the blockout material may run, so be sure to hold the model horizontal. It is not necessary to use the white light to cure the blockout material. Put the dye spacer material on from second bicuspid to second bicuspid. At Lifelike, we suggest using stent material that is .040. It may be necessary to use a .080, but we only suggest it for bruxers, as they may chew through the lighter material. At this point, place the material in the clamp of the vacuum former, making sure to position it slightly to the distal end, as it will move forward when clamped, only slightly. Turn on the heating element after you position the clamp below it and wait for the material to droop slightly. Make sure the model is in a U-shaped form, as this will allow better suction. Or, if you have a base on the model, be sure to drill some large holes. Once the material begins to droop, drop the clamp onto the model, then turn on the vacuum. Turn off the heating element and squeeze the material around the model to ensure a tight fit interproximally. Remove the stent from the model and cut away any excess material, making sure not to cut into the arena of the junction between the tooth and the gum. Once this has been done, reposition the stent back on the model, making sure that it is positioned correctly. At this point, take a free-flowing ballpoint pen and draw the junction just between the tooth and the gum. Do the lingual as well. Once again, remove the stent from the model and trim away the material to the first molar, which will allow the patient to have better proprioception, which may be important for people who have TMJ disorders. Using crown and bridge scissors, carefully trim along the line, making sure to cut only on the line, which will position the edge of the stent about a ½ millimeter onto the soft tissue. This is attached gingiva, which will not burn. Once this is completed, do the same procedure on the lingual side. Once the trimming is done, reposition the stent back onto the model to make sure that it fits perfectly. The patient will then fill each reservoir using Lifelike's patented seal syringe. 1/2 cc of Lifelike bleaching gel. Either the unflavored U gel or the wintergreen flavored V gel can be used. The patient will then reposition the gel-filled stent over their teeth.
Wow, that's quite a book you've got there.
Yes, there certainly are some beautiful smiles in here.
Hello, my son. I'm Dr. Noah Payne, and you can relax because you will be cared for by these hands. These hands have cured gingivitis, drilled away life-threatening cavities, and have attached exquisitely designed lifelike porcelain veneers. Yes, my son, you have nothing to worry about because you are under the care of these loving palms, dexterous, magical fingers, divine digits. But I take no credit for the workings of these magnificent hands. I just step up and watch them perform their magic. Now let's see here.
Oh my, yes. I must say these are beautifully done x-rays, taken by a most beautiful dental assistant.
You shall have a beautiful smile soon. Go, be as one with your bleach, my son. Be as one.
It takes at least 2 weeks for teeth to rehydrate after the bleaching process is complete, so it's important to wait at least that long before replacing any crowns, veneers, or composite fillings. Every package of Lifelike bleach includes an instructional brochure, but it's also important for you to teach the patient how to use the product. First, the patient should floss and brush their teeth before each bleaching treatment. Then they should fill the facial reservoirs with 1/2 of a cc of bleaching gel. This is easily accomplished because of calibrations marked on each Lifelike seal syringe. Reservoirs for the front 6 teeth should have the most bleach, while the reservoirs for the posterior teeth only require enough bleach to secure the tray in place. Blot dry the teeth with a dry cloth or tissue before inserting the filled tray. The patient should then rinse and dry the tray or turn it upside down and allow it to dry naturally. Here are some helpful hints to pass on to patients who are getting ready to bleach. If the teeth become sensitive, avoid any drink with citric acid such as grapefruit, oranges, tomatoes, wines, and especially apples. If gum irritation or thermal sensitivity persists, have the patient call your office immediately. We suggest prescribing tubes of fluoride that can be used in the tray on alternate nights to reduce sensitivity. If the patient notices spots or vertical or horizontal lines, it's nothing to worry about, as they will be gone in the next few treatments. If the tray turns purple, just assure the patient that it only indicates the presence of zinc in their silver fillings. Keep the bleach refrigerated to increase shelf life. Also, keep the tray away from heat and the dog. They love anything that's been in your mouth. Don't smoke, eat, or drink with the bleaching tray in place. Bleaching is not recommended for pregnant women or pregnant men for that matter, or nursing mothers. Complete bleaching on the upper arch before doing the lower so that the patient gets the degree of bleaching difference and also to prevent any DMJ problems. If the patient is having any crowns or fillings done, it is best to wait at least 2 weeks for the teeth to rehydrate to achieve the true shade.
Now, don't you worry. This shouldn't take long, especially with these miracle workers. Please give me an amalgam carrier. Well, what an amazing day we have today. I asked for an amalgam carrier, and that's what she gives me. Will wonders never cease?
Okay.
Well, yes, I do see some staining on your 7th bicuspid.
Okay, yeah.
Yes, I suppose that could affect your love life.
Okay, yeah.
I'm glad you asked that. Girls, this young man would like to know about tooth bleaching. Do you think you could help him?
Ready? 1, 2, 3. So you want your teeth whiter, you want your smile brighter. No more dingy pearls, now your smile will win the girls. It's easy and it's fast, you'll get a what you know will last. It's Life Like V, it's Life Like V with a wintergreen taste that's great, you'll see. So don't put it off, don't you delay. Start bleaching now and you'll be A-OK.
Aren't those the best assistants you've ever seen?
Yeah, great. But can I just go out and buy one of those bleaching kits I see advertised on TV?
Well, you could, but you wouldn't have a very happy dentist. And you wouldn't have a beautiful white smile. But because I examine your teeth before you begin, you can be sure that your teeth will come out whiter and brighter.
Does it hurt?
Does it hurt? Be a man. Be a man. Actually, very few patients experience discomfort. In fact, only 3 to 4% of patients ever experience any sensitivity, and that normally disappears when treatment is stopped. So what do you think? Are you ready for a whiter, brighter smile?
Yeah, I guess so.
Okay. Nurse, get me a gallon of Clorox.
What?
Just kidding.
One thing that the dentist might like to offer to his or her staff is a reward system that will motivate everyone to promote bleaching. For more information, contact Lifelike for a variety of incentive programs. Obviously, every dental office is different, so you will have to take the information that we have provided and fit it to your own staff and office. But remember, the most important elements are everyone in the office should participate in getting patients interested in bleaching. Everyone on the staff needs to have their teeth bleached. And a good marketing plan with coupons, articles in the newsletter, buttons, and new patient incentives should be designed and implemented. Bleaching is a profitable business for any dental office because it can be done with little or no time requirement from the dentist. Also, it's a great way to get new patients for other procedures, and it helps to generate income through added new patient exams, x-rays, and prophylaxis. We hope you have enjoyed the show, and more importantly, have gained new information that will help your office generate new and happy, smiling patients.
You need me, I'll be on the golf course. God, I love being a dentist. Thank you, Lifelike.
Any successful marketing effort requires the right tools. Here at Lifelike, we offer a professionally designed marketing kit that includes the video that you are watching, plus a patient brochure that is a 6-page primer on tooth whitening and why dentist-supervised whitening works best. The kit also includes a package of 100 statement stuffers, which offer your patients the 6-page brochure just for asking. We also provide multiple countered placards to place around your reception room and operatories to prompt questions and brochure requests. Ask Me buttons that will subliminally prompt your patients to ask, and an instructional booklet that comes with full instructions detailing the best use of the kit elements and supporting what you've seen on this video. The most important question, of course, is when you're getting a history, ask your patient, are you happy with the way your teeth look?
It is my fondest wish that you enjoyed our film about tooth bleaching and will apply this system in your practice. On the serious side, bleaching has come a long way in the last few years. Material was not very viscous and came in bottles and tubes. Now bleach is delivered in syringes. The latest advancement in the bleaching world is the lifelike sealed syringe. The sealed syringe is the easiest, most user-friendly delivery system available. Just a twist and it's open, a twist and it's sealed. The sealed syringe is calibrated for precise dosage control and better patient compliance. The dentist-designed stent and the sealed syringe are the ultimate in efficacy and safety. Bleaching can have a positive effect on our patients' lives. What a wonderful service we're providing. Thank you again.